So we're circulating the blood, which is one of the benefits of massage. Do that 2 or 3 or 4 times. You'll get the hang of it. Oh, by the way, I forgot one thing to add. While you're doing the session, it's always good to have a low light setting and also have the person or patient close their eyes. So close your eyes. And for sake of shooting this video, we do have our lights on, but in a real session, I would have the lights off or dimmed. Okay, good. So as I'm done with that, now I'm going to work the scalp. And in my 12 years of experience, I've found that this one area could be the key to unlock and get rid of the headache. A lot of people store tension in their scalp muscles, and they're very unaware of it. But what happens is tension levels get to a certain point, it turns into a tension headache. So what you're going to do with the scalp is you're just going to wiggle your fingers through the hair until you feel like you have a good grip on the scalp. And again, all you want to do is hold on to the skin, push a little bit, and do circles. Circles all the way up. You'll do one side all the way up to the middle. Like that. Making sure that you feel the scalp, the skin on the scalp actually moving. You want to. It's almost like you want to stretch that that tissue. So I'm stretching as I'm rotating with my little circles. Then you come to the other side and you do the other side. Good. And if you've got good sensitivity in your hands, you want to feel for where the tight spots are. And those are the areas that you really want to put a lot of attention onto. Put your thumbs in the middle and you do rotation all the way down the middle of the skull. All the way from the hairline as far back as you want to go to the back of the hairline. Okay? Now this next move is very important. What you're going to do is you're going to actually squeeze the head, but you're not squeezing the bone. What you're actually doing is you're squeezing the scalp tissue, and I think of it as I'm wringing out the tension in her scalp. So you take the palms of your hand and you get a good grip here, and you just squeeze in and up, like you're squeezing the skin together towards the top of her head. Just be careful that you're not pulling the hair and it's hurting the person. They'll give you feedback. And again, with my palms, I might, on the way down, do a little circle, and then I'm going to squeeze up again. Got to get a little bit of leverage here. You could also do this with the patient or the person laying face down as opposed to face up. You could also do this in the forehead. You squeeze the forehead together. You'll see it wrinkle. And then come back around, do little circles, getting the blood flowing, and most importantly is you are stimulating the tension in the scalp muscles, in the cheek muscles, in the temple muscles to just go away. And oftentimes when just getting rid of the tension through the neck and the scalp, within minutes the headache is gone. So that's my little session that is about 90% effective in getting rid of a tension headache very, very quickly. Oftentimes a patient will get up after this session and have zero headache pain. A couple more things I want to talk about with headaches that you can help yourself at home with. Some tips. Number one is you want to go home and you want to put yourself in a place that's quiet and dark or dim lighting, no bright lights. And you also want to use some ice. You want to take an ice pack, or if you don't have an ice pack, you can take a cold bottle of soda or a can of beer or soda, something like that, and you want to put it right on the back of your neck and lay down on it. Okay? And then you want to take an ice pack. They make specific ice packs for your forehead. You could probably pick them up at a local drugstore or pharmacy. Or you could just get a regular ice pack and put it on your forehead. And you close your eyes, no light and no sound, and just lay there with the ice here and here for about 20 minutes to a half an hour. That also is a very good tip to get rid of the headaches. One last point I want to make is that if you are somebody that is having what I call chronic headaches, meaning you're having them multiple times a week or more, or daily, a lot of times you could be having what's called cervicogenic headaches. That means that the cause of your headache is actually coming from what's called a subluxation, or too much compression in your neck or your cervical spine. In that case, that type of a headache usually will not resolve with this technique. Usually, or probably, you need to go to a professional who is trained to relieve and realign the neck joints and the neck muscles. A chiropractor is a very good choice. So I hope this is very helpful for you. I thank you very much and looking forward to seeing you on my next instructional video. Thank you very much.